first use case we have is actually coming out of New York. So in New York right now, data is being used in a way that previously it hasn't been. And these are not solutions that take weeks to months to put into place. They're solutions that literally can be put into place immediately. Just one moment. So by partnering with data that organizations already have access to, in many instances, outside of the medical staff offices or outside of the credentialing teams, there are also people who work in the analytics space. And a lot of those analytics teams have access to other types of data from outside organizations. And we won't get into the technical terms as to what this means, but in essence, they may have partnerships with different industry vendors. And in the healthcare space, there are dozens upon dozens of these industry vendors that are out there that have data available to them that is oftentimes able to be integrated into electronic medical record systems so that providers can gain access to the different tools that they need immediately in order to mobilize and start to provide that patient care. And it's not something that takes, you know, days to weeks to get into place, but instead it's something that can be integrated immediately. So I would certainly recommend that if folks don't already have a firm footing in this space, that they take a look at putting this in as a mid to long-term strategy. And I can tell you from personal experience that right now, a lot of these types of business partners, and this is just an example of one because they brought these use cases to the table. I'm using LexisNexis as an example, and they're the ones that are implementing this particular solution. But as I mentioned, there are dozens out there. I can tell you that right now, it's definitely an opportunity that if you had it on the horizon to partner with any of these organizations, they're being absolutely accommodating to the needs of healthcare organizations, negotiating some crazy discounted deals, opening up databases that they wouldn't otherwise, to be able to get data to the people that are needed right away in order to have these key decisions made. So let's talk a little bit also about finding the right providers. So in this instance, we assume we have the providers. We simply need to get them into the system as quickly as we can. But what if you're in a market where you can't get those providers or you don't have the specialties that are needed?